Now, germline mutations in BRCA1 and BRCA2, as we know, predispose to autosomal dominant hereditary breast and ovarian cancer, and in ovarian cancer are almost exclusively associated with an invasive epithelial carcinoma. The estimated lifetime risk of developing breast cancer is quite high in these mutation carriers, 60 to 85%, with a lifetime risk of developing ovarian cancer for BRCA1 mutation carriers, 25 to 45%, and about 10 to 25% for BRCA2 mutation carriers. And in general, the referral for genetic counseling has historically been based on family history, and a family history taken by, the surgeon or the oncologist. Now, there aren't a lot of publications on the incidence of BRCA1 and 2 mutations in the Indian population. However, I did come across this one, which was perhaps one of the larger ones that I saw. So 61 women were screened for BRCA1 and 2 mutations, and this is a high-risk group of women identified with a family history of breast or ovarian cancer, and they were treated at Kidway Memorial Institute of Oncology in Bangalore. And 15 BRCA1 gene mutations were identified, comprising about 25% of the patients, whereas BRCA2 gene mutations were only observed in 2 of the patients, or about roughly 3%. Ovarian cancer mutations occurred overall in 40%, breast cancer in less than 25%, and a combination occurred in 30% of patients. Now, as I mentioned, the referral strategy historically has been based on having had a family history of breast or ovarian cancer. And in this study by the Vancouver group, they wanted to estimate the frequency of BRCA1 and 2 germline mutations using a histology-based referral strategy. So between 2004 and 2009, patients with non-mucinous epithelial ovarian, primary peritoneal, or fallopian tube carcinoma were invited to participate in tumor banking and genetic counseling, irrespective of family history. And what they found was that overall, 20% of patients were found to have a germline BRCA mutation, and this was exclusively associated with high-grade serous carcinoma. So no patient with low-grade serous carcinoma had a BRCA mutation. As they looked sort of more carefully at how the referral, if they restricted the referral for germline testing to BRCA and family history ascertained by clinicians, they actually would have missed 14 mutation carriers, lowering the overall detection rate to 9% from over 20%. Now, genetic counselors did a little bit better at obtaining or ascertaining a family history and would have caught 60% of the cases, though they still missed 5 of the cases, which represented, overall 19% of the identified BRCA mutation carriers due to lack of a family history.